the Center for Disease Control has changed its guidance on respiratory illnesses with significantly less isolation time. This includes COVID-19 and the flu. As the CDC says, the United States is seeing a large decrease in hospitalizations and deaths. Before March 1st, anyone with a respiratory virus such as COVID-19 and influenza was recommended to stay home and away from others for 5 days.
After 4 years, we have enough herd immunity, enough people who have been immunized, enough people who have had it, whether they know it or not, that we're pretty much safe from this virus causing major problems, except if you're in a high-risk group.
The CDC now suggesting that anyone sick with these viruses quarantine until symptoms improve overall for at least 24 hours. Adding if symptoms include a fever, it disappears without using fever-reducing medicine. At that point, the center suggests returning to normal activities like work. The next 5 days include being around clean air, wearing a mask, and keeping distance between yourself and others.
Be aware of the environment that you're going back into, that it's not a nursing home, that it's not going to be populated with high-risk people.
The new recommendations from the CDC follows downward trends here in New York that are also more stable compared to the start of the pandemic. Dr. Saperstone says the good news is thanks in large part to the COVID-19 vaccinations.
We have the latest vaccine, which came out in the fall, which is much better than the previous Omicron vaccines. Maybe 5% of those people that had the vaccine ended up in the hospital versus 25% before this latest vaccine.
This guidance does not change what is already in place for healthcare settings, even with less positive tests being reported to New York State. The CDC says it is important to protect those over the age of 65 and anyone with weakened immune systems. For more information on COVID-19 and further details on the updated recommendation, visit news10.com. Reporting in studio, Anthony Grolakowski, News 10 ABC.